Again, you know, if you had somebody who lost their job or something like that, that's a qualifying event. I don't know if you're here for that part, so I just want to clarify. So that 6 month is open enrollment, but there are a number of qualifying events. I can show you the slide if you're interested at the end. You know, somebody has a baby, somebody loses a job. Those are all things. Somebody becomes lawfully present. So I was not lawfully present, therefore I couldn't get subsidies on the marketplace. Now I am lawfully present and I can get subsidies on the marketplace, those types of things.
Okay. But I have to ask, what does lawfully present mean?
It's around immigration status.
Thank you.
And again, for people we're working, you know, I did something with the Refugee and Immigration Healthcare Collaborative here, and we've done some things that there's great information out there at Maine Equal Justice Partners on various statuses that I never knew of before.
Okay.
And what their eligibility is, whether they're eligible for Maine Care Medicaid or if they're eligible perhaps for the subsidies. And it's in multiple languages, so really a lot of great information that Maine Equal Justice Partners puts out. And we can get that to folks as well if they need it.
Yeah, that's what I was going to ask.
Yep, I have that material on, you know, electronically. I can send that to you if people are interested.
What happens with your plan if you move out of state? Is there, like, is it like I tell you a month ahead of time and I can end the plan, or do I have to keep paying for the year?
You know, I would encourage you to call our member services, that 855 number. They're excited. They've actually been really busy this week. And the reason for that is there are different considerations. Like, let's say you're a college student, or you're going to do an 8-week stint through your work, or you're actually moving, right? Mm-hmm. You need to reside in Maine to be eligible for the Maine marketplace. So those considerations I wouldn't want to tackle until you know your circumstances. And then I would kick it down to, you know, our member services or the navigators, those people who are going to walk you through.
Like, you're moving within 2014 to another state. So I'm moving in May. Would I want to enroll or just wait and pay the fee and sign up for the plan in a different state?
You know, I'd have to look. My sense is you'd have a qualifying event where you were moving out of state, but again, I shouldn't postulate. So I should have you, I should get back to you. Yes, exactly. Call me or email me and we'll get an answer back to you, unless Kate knows the answer.
Well, I mean, are you talking specifically about Maine Community Health or any policy?
I've never had healthcare before, so I don't know how it works. If you have healthcare and you move to another state. So if you enroll for a plan, that sounds like...
So the marketplace is going to open in October, and anybody who signs up for January will have to do so by December 15th. So you can sign up for January, and then when you're going to move, find out where you're moving to, let your carrier know. The way it stands now, all insurance policies are month to month. You pay your premiums monthly. If you don't pay your premiums, your policy goes away. So I would imagine that if you give whatever carrier 30 days notice, courtesy, let them know that you're moving out of state, they'll be happy to end it. It also happens that the end of the open enrollment is the end of March, which means that you could in fact sign up if you did between March 15th and March 30th or 31st. You could sign up for a plan starting May. So you may land in time to sign up during open enrollment, but it is a qualifying event, which means that you're allowed to sign up outside of the open enrollment.
And don't forget, every state's going to have the equivalent of the marketplace. Some of them will be state-based marketplaces. Maine opted not to do one, which is why we're on the federally facilitated marketplace and we're part of healthcare.gov. But wherever you go, you can do the same process and see who's on. You know, go to the marketplace and see what you can.